afternoon, everybody. This is Dr. Jeff Culbert from Schooley's Mountain Chiropractic Center, where we love to consider ourselves your leader in alternative healthcare. And this past weekend, I went to a seminar out in Chicago, and one of the things that we were talking about was kids, and especially babies, and getting babies under chiropractic care. And, I've got to tell you, one of the things that I'm most proud of is when we are posting our YouTube videos, especially our adjusting videos, the response that I get, even from a short that's only 15 or 20 seconds long, is when we are adjusting babies in the office. And a lot of times I get a lot of comments, especially from patients coming in who get to see these little infants coming in and getting their adjustment. And so the question I often get is, Dr. Jeff, what could possibly be going on in an infant's life, especially that young, that requires that the mom and dad want to get their babies adjusted? Literally, sometimes coming home from the hospital. Let's look at it this way. You've got a baby that's growing up in the womb of a mom. And that baby and that mom are intimately connected, both emotionally as well as biochemically through the placenta. What studies have shown is that we are now at a very critical point in our society where we have more luxuries and more conveniences, but we still are one of the most stressed out species of all time occurring right now, where we have so much stuff going on. So part of the discussion during this pediatric portion of the seminar that I was at comes down to moms and mom's overall health. And we've got a dichotomy going on with moms at the same time. It's an extremely joyous time being pregnant, but at the same time, the mom is overloaded with stress and a lot of biochemical and hormonal changes, and that creates the biochemical stress that's going on the mom. She's very excited, but yet she's also very anxious. She's going to have a new baby coming into this world. This is a crazy, stressed out time. We have everything that is now post-COVID. We have inflation. You name it, we've got it. Just a lot of stress that we have out there. So mom is excited, yet stressed. She's anxious, and she's sleep deprived in many cases and nutritionally deficient, although she's taking nutritional supplements to try to do that. But when you're in a fight, fright, or flight mode, there's very little nutrition that gets broken down, digested, and absorbed into your system. So all of this has an impact on the baby that is growing in the womb. And ultimately what happens, this baby comes out stressed, challenged, not so much on an emotional level, because again, we don't know what the baby's thinking about while they're in the womb, and certainly not on a physical level. But at the time that all of this stuff is going on, there are biochemical and hormonal changes that are going on in the baby. And then as the baby's passing down the birth canal, you've got a big set of hands, you've got sometimes forceps, or you've got a vacuum pulling this baby out of the womb. And then if the baby's been pushing and pushing and pushing to get out of the womb, and then all of a sudden you've got hours and hours and hours of the baby's making no progress, and there's all of a sudden the need for an emergency C-section, and all the anxiety that goes on with that now, going in with the anesthesia and getting cut and everything that goes on during a C-section. So the baby comes out of the womb having sustained a lot of biochemical stress and then possible physical stress as the baby's coming out and being born. And then they're adapting from a nice, warm, cozy womb into a cold, stark environment where there's a lot of noise and clanging and banging of things going on around them. So the baby's coming out stressed already. And the problem is, then we're going to start to assault this little baby with a whole bunch of shots and vaccines that are going to be starting almost immediately. And the problem that this seminar was going into, and one of the reasons why we have a rise in autism and ADHD and all this other stuff going on, is the fact not so much that it is the medication, and while there's plenty of evidence out there to assume that it is medication oriented, the gist of what we were getting at was that the baby's ability to respond due to spinal subluxation caused by biochemical and physical and environmental stress coming through the birth canal, they have a lack of ability to adapt to their environment and the stuff that's going on and into their bodies as a result of modern medicine, thinking that vaccines and everything that's done are the right way to go. And in some cases, we can have a whole separate argument and discussion about that at a later time. But I do have great concerns that in this day and age, with the amount of stress we're creating, it is producing kids that are stress challenged right from birth, and that to get their bodies adjusted, mostly in the upper cervical region, but with what we do in the office with AK muscle testing and utilizing mom and dad as surrogate testing, we can often find what is going on very simply, make gentle chiropractic adjustments to this baby because, again, the muscles and the ligaments, the joints, again, you have to be extremely careful. So I think we've developed a system in the office with the muscle testing and the use of an activator or working acupressure points to start to calm this baby down. We do have a reputation. If you take a look at our website and look at our Google reviews, we've got very, very good reviews, better than most docs in the area, which I take kudos to because myself and my team have taken the time to create a caring environment that is poised for the mom while she's pregnant, and then for her after delivery and taking care of both her and the baby if that's what she chooses to do. And we have a good percentage of patients that when they have come in with their babies are getting checked on a very regular schedule, whether that's once a week, once every 2 weeks, once a month. We have them under some form of regular care to help their nervous systems to adapt and accommodate to the ever-changing environment that's going on around them. One, with things that are going on nutritionally, because if mom is breastfeeding, when she's eating and digesting and assimilating foods and fluids, well, that's going to create a biochemical change within the baby. If you're going to a regular pediatrician versus a wellness-oriented pediatrician, and you get the baby on a schedule of shots right away, well, there's going to be biochemical stress that's coming in. The goal is that these chemicals coming into the baby are going to have an overall positive effect, but for some kids, they have a failure to adapt to the toxins from these shots that are coming in. Well, the goal is to help the baby. Some just have a problem with it. I know my grandson, he had a particular reaction with the DPT. First time he got the DPT, he had a fever that wasn't overly high. It was about 100, 101, 102, somewhere in that range. But when he got his second DPT shot, his temperature spiked at 107. Now, fortunately, my daughter was seeing a pediatrician who at the time said, this is not normal for this particular shot. We're not doing this again. So at least we had the pediatrician who was recommending the shots know that we had a reaction going on, and it was time to pull that shot for this child, which was, I thought, was a smart and prudent thing for that pediatrician to do. But again, between biochemical stress, physical stress, and the emotional stress of what's going on with the mom and her environment while the baby's in the womb and coming out and being exposed to the stress that mom and dad have, and if it's being the third or fourth child into a busy house, there's a lot of craziness that goes on. I know we had 4 kids, and by the time we had Matthew, our last one, it was a nutty household. And now that we have 4 kids, 3 spouses, numerous dogs, 1 that lives with us, and 5 grandchildren, at times it's mass chaos. And for these little babies, again, being in an area of mass chaos, again, there's a lot of reasons why you can assume that a baby is going to be exposed to emotional stress. And to the wellness or to the degree that their nervous system is balanced and functioning properly, we know that nerves that are not impeded upon are going to affect 5 different areas of the body, and that is muscle, joints, organ, glands, and skin. So if a baby is being adjusted and adapting well to their environment and to the stresses that are being applied to them, both emotionally, biochemically, and physically, we know this body is going to be able to adapt to the environment and thrive in the environment. So the gist of today's conversation is, for all those moms and dads out there that have subscribed to our channel and like what we're doing, I need you to start to think and consider, isn't it time for you to get your kids or your babies getting checked by a competent chiropractor, and then on a schedule of adjustment that makes sense for you and your family. This way we know the baby nervous system is balanced. We know that the nerves are functioning properly to muscle, joint, organ, glands, and skin. They're going to be able to adapt to their environment, and that ability to adapt to an ever-changing environment is what's going to help that child thrive through toddlership to preschool, to school, to high school, college, and well beyond. And it makes it a part of their normal wellness-oriented lifestyle. They're going to have a pediatrician, they're going to have a regular doctor, females are going to have an OBGYN, the kids that are going to be involved in sports are going to maybe see some sports doctors or some orthopedists at time. What you're trying to do right now for your infant is to create their healthcare professionals that are going to guide them from birth through young adulthood to their senior citizens, old age. So you create the healthcare environment, you create the healthcare team, the babies thrive, the kids thrive, and you're going to find overall that they're going to require less medications, less surgeries, less visits to the doctors. It just sets up the environment and for their body's ability to thrive, just not merely survive in this world that we have created that is really stressed out now. So if you've liked anything that we've said today, please hit the like and subscribe, and don't forget to share to see friends, families, and other loved ones. And if you're interested in coming into our office, please visit our website, smcc4u.com. Go to the patient section. If you'd like, give our office a call, come in for an appointment, or at least get a look at the environment of what our office has to offer, or shoot us an email at the email address there. I'm more than happy to have you in the office. And if at any point in time you do have any questions, please don't hesitate to shoot a question or a comment in the comment section. I'll be more than happy to respond to you. In the meantime, this is Dr. Jeff Culbert from Schooley's Mountain Chiropractic saying, hope you have a great day. Hope you found this information helpful and useful. We'll look forward to seeing you in another video. And I have heard your comments. We will be getting another adjusting video out really soon. Thank you and have a great day.